Hello, welcome to Holistically Speaking. I'm Morala DeVoe, your host. Our mission at Holistically Speaking is to be the avenue through which the voices of holistic health reach you at the time you need it most. And today we're going to be talking about your babies, your kids, giving you information about some possibilities for care for your newborn babies, your 6-month-old babies, or even your toddlers that you may have never heard about. My guest today is Dr. Erin Sepic, who's been our guest on the show several times. Welcome, Erin.
Thank you so much for having me.
I'm so happy to have you on the show now to talk about babies. A couple weeks ago, we talked about pregnancy and delivery and all of the ways in which chiropractic can help expecting moms, and hopefully the same expecting moms might be watching today, right, and learn a little bit about how what we called the show today is how the integrative chiropractic approach can help inform their care of their babies. So let's start by, I guess, setting the stage for our moms and dads, talking about what do you mean by integrative care? What does that look like in your practice?
Right, and in my practice it looks very, it's a very well-rounded approach to a lot of typical, very common childhood ailments. So I specifically do some basic homeopathy. I do a fair amount of diet recommendations. I do work with essential oils and supplements, but I do the body work, very, very gentle baby adjusting. So that's like the main piece that you come to a chiropractor for, to get them adjusted, take a lot of stress off their nervous system, help them deal with whatever it is. Then we have more specific, targeted, well-rounded approach to whatever the specific issue is. And ergonomics is one of the things that I do a lot of. So I try to give parents as many tools as I can that they can use while at home, because they're with the child a heck of a lot more often than I am.
So you're already mentioning a few things that I think parents probably have never thought about. You're mentioning nutrition, and in most cases, newborn babies are either breastfed or they're on formula, so they're probably not even thinking about nutrition. Like what is it that you could possibly do? Homeopathy, I'm sure a lot of people aren't thinking about that or even heard of it. Structural care, so does that mean adjustments for the babies?
Yeah, adjustments and some really gentle myofascial work as well, depending on the severity of the case and the age of the child.
And ergonomics, so you're mentioning a bunch of things that I think most people haven't even
That's true.
heard about and even think about it for their babies, much less so. So how early, let's start off with probably the things that maybe, some of the moms at home might have, winced a little bit at the thought that you would do a chiropractic adjustment on a baby. What does that look like, and how young can they be? Do you have to wait, or how soon can you do chiropractic, and what does that look like?
It's always a good idea to look for a specialist in pediatric care or perinatal stuff, but it's really a very safe modality. And while the traditional and highly publicized types of chiropractic adjusting, it's called an osseous manipulation or a grade 5 mobilization, physical therapists call it, and it's a fairly aggressive looking, quick force that gets put into the spine very safely by somebody who's very well trained, and it's incredibly safe statistically.
And that's the traditional like cracking.
Yeah, that's when you hear the
adjustment.
noise. Yep. And I do some of that in my office. I don't ever do it on babies. I have one of my toughest torticollis cases right now who's delightful. And she's doing so well, but I might get to the point, and I warned the mom today, if I see her again next week and she's not at least 60% better than she was the first day she came in, then I might do a little vibration adjustment, where it's a very, very gentle touch, but I do a little bit of shaking, and somehow the child's spine tends to sort of just respond better to that.
Yeah. And how old is she?
She is nearly 6 months now, 7 months. So she's older, but a newborn, there's no need to do that. The fact that she's been here for quite some time now.
So her
neck
sometimes
necessitates slightly more force.
Just about to ask you, what does torticollis look like in a baby?
Torticollis looks like, and it often, and this child she's divine, she's lovely. I mean, all babies are amazing. Often torticollis becomes an issue if because the child's often not comfortable nursing off of both sides. There's one side they just don't want to turn to because it doesn't feel good. So they, somebody has to pump there, or they figure out a different way to do it. But someone notices that something is
that the
awry.
baby doesn't want to turn in a certain direction.
So either they're fine like this, but they won't look this way, or they're actually stuck in rotation or lateral flexion. So lateral flexion.
And I'm curious, what made
causes
this baby have torticollis?
There's often, the most common causes I've seen are relative birth trauma. Sometimes you can have in utero constraint where the child is in just a funky position for a while, even when they come out beautifully, perfectly. They'll come out and lie in your arms like this.
Yeah.
So even in a perfect birth, if the child is anything but 100% aligned, there can be so much force, even when there's no traction on delivery, there can be enough force to actually create a significant subluxation in a child's C-spine. And you see it most often around the nursing. Probably the most referrals I get from professionals for babies in my practice in the state of Vermont is probably from lactation consultants.
Yeah.
Because they notice right away.
So assuming that you have a mom watching at home, an expectant mom that might be due for delivery in a few weeks or whatever, what would you say to that mom in terms of the things that they should consider
look for
when the baby's born?
I think the most common things, the reasons babies come in to see me is often for some, and this is not because I treat these specific conditions. Being a chiropractor who specializes in pediatric care, I do a lot of adjustments on children that suffer with these conditions. And statistically, they tend to get a heck of a lot better. But I'm just adjusting their spine and dealing holistically, as I had said before. Pooping is really important. If a child is constipated, they're not happy.
Right.
Sleeping is incredibly important for all involved. Nursing, or at least latching onto a bottle, and feeding and gaining weight, those are 3 incredibly important things. If the child is upset for any reason consistently, colic is probably one of the top emergency, like, go see Erin. Like, I came and I told the could you fix this? The child is really, really uncomfortable. And that's really, really frustrating because they can't tell you what's wrong or where they hurt or what's happening. So for new moms, I think, if everything goes great, there's no real issue. It's kind of fun to teach, I wish I had my little doll here, to teach parents how to check range of motion in sleeping newborns. Very, very easy to do, very gentle. And you just read their body language and their expressions as they're sleeping. If they don't want to turn that way, they're not going to turn that way. You don't turn them, you just offer the turn. And if they don't take it, they don't, try it again just to make sure they weren't in a mid-dream or something.
Right.
And it's easy to check lateral reflection, extension, rotation.
And this is as newborns.
As newborns. Very gently. Very, very gentle. But if they have a range of motion limitation or a discomfort, or they're not pooping, or they're not sleeping, or they can't latch properly, those are all issues that.
And what are some of the things that you do? Because I'm so curious as to what that adjustment might look like.
Right. Yeah, it's really, really gentle. Newborns, 99% of the time, sleep right through their adjustment. They're usually, because they sleep a lot when they're really little, if everything is decent.
Right.
So if they have like a structural issue, as long as they're in their happy place, they're not bothered. So taking them out and showing mom or dad which ranges of motion really aren't, they usually know or have an idea which ranges really aren't being tolerated well. And then I just lay them, they're usually in my lap or they're on top of mom, or if they're sleeping, I usually put them in my lap and we're all right nice and close together. And I do some very, very gentle contacts with my pinky, most often. On newborns, always with my pinky tip. And very, very gentle contacts. Very, very gentle.
And contacts where?
On their vertebra. Right on the vertebra of their spine. I also do a lot of cranial work, and depending on the reason they're coming in, I can do some really gentle cranial manipulation as well, which they maintain total sleepness for the entire treatment. And then we recheck the range of motion.
Right.
And the parents are always blown away how, wow, they're just no problem, like, all the way over. So that's how I know that what we did worked.
Right.
And I get to teach them how to check that as well.
Yeah.
And if they're coming in for constipation, even if they're asleep, like probably 65% of the time they'll soil their diaper while, like, mid-adjustment. It always happens like 15 minutes before after they leave, if it lasts that long. Right. And it's super fun because kids need to poop.
Yeah,
they
and
really
the parents see the immediate
result. Their nervous system is it's incredible.
So you mentioned colic and sleep issues, constipation. What are some of the classic things that maybe you get calls at your office from parents, you know, saying, my kid has blank. What are some of those things that they call you for?
Right. Sorry, you said colic and torticollis we'd covered, which is sort of a spastic neck presentation. Latching issues, they'll often get sent in with that. TMJ sometimes, so if the latching comes with a click, or if they have a really hard time, sometimes when the TMJ is off the child, the only way that they can suck appropriately is to shear their jaw back and forth. As you can imagine, that's excruciating for the mother. So that I can do, I can help a lot working both cranial and TMJ, making sure that the C-spine is aligned so that that doesn't happen, and it's obvious right away. There's a lot of hard palate work sometimes because you get kind of mushed in there on your way out. So it's easier to have somebody go through and sweep the hard palate, and when they're newborns, they don't mind at all. And I can feel what's wrong, if anything, with their hard palate by how they take the tip of my finger, and we get them adjusted from the inside, just like that.
Oh, interesting.
It's very, very gentle. I never force it. I always ask, and it's just a really beautiful dance. I'm trying to think. TMJ, torticollis, ear infections don't happen until quite a bit later. Sleeping, sometimes I think car seats. Some children really don't enjoy being in car seats, and depending how much the family has to travel, they may or may not need to be more comfortable. But sometimes as soon as you put them, and it's not that you're putting them down and they don't have mom or dad, like you can put them down anywhere else and they're fine, but if you put them in there,
they hate
all
it.
heck breaks loose. So I think part of what I can do is make sure that their sacrum is aligned, because if it's crooked, they're sitting on that for the entire 6-hour drive to New York City or whatever to see mom and dad. Really helping pad appropriately and making sure the alignment is optimal so that they can be most comfortable. And for really little newborns, those car seats, there's no head support. So helping patients and their parents work out adequate support.
So how early, as a newborn, how early can they have an adjustment, or would you even recommend an adjustment?
It depends on it doesn't really depend. You can be adjusted at birth. Absolutely. And I have a lot of colleagues who do that, who attend home births. And they just show up that day or the next day and get everybody checked, and that's fine. Probably the youngest I've had in my office is 5 days old. It's interesting because I got into pediatric care originally because I met adults in clinic as a student, as a resident doctor with decades of migraine histories and whatnot, and I began to realize that a lot of this happened when they fell off the slide when they were 6, or some of them, always, parents said, always, you cried for your first 2 years and then, have dealt with headaches ever since, or shoulder dystocia, or, a lot of funny things that, thank you, that will present as pain down the road. And the earlier that you can get your hands on a person, the easier it is, the more gentle, and the longer it lasts. So I got motivated to get them as early as I can. So if I just sort of say, if there are any problems with all of the above functions, if everybody's sleeping and eating happily, easily, pooping several times a day, that's great.
All of a sudden you're making me think of forceps or vacuum deliveries. Do you see a certain pattern of the babies who were born that way?
Yeah, it's really tough. When we like to have, as we were talking about with the labor and delivery, choosing our birth team very carefully and making sure that you guys are all on the same page with what you would and wouldn't like. Sometimes when kids get stuck, they need a little bit of help, particularly if one party or the other is in a hurry. They need some help. So sometimes there's forceps, more often than not now there's vacuum. But some of the force that goes into those heads, it's pretty amazing. One of the babies I'm seeing right now has a bit of a horn on one side of her head because they thought she was vertex, but she actually wasn't. And there was quite a bit of force pulled in there, so it'll misshape a head. And we can work through that with a lot of cranial stuff, which is wonderful. But that type of force, like the force that's naturally happening, is plenty.
Is already
it's
intense.
Plenty. So we try, and I'm sure obstetricians try to not intervene when they don't need to, but sometimes when you need to, that's a perfect case. Thank you for illuminating that. To call and get checked by a craniosacral practitioner, a chiropractor, somebody who specializes in infant care. Because you really want to make sure that that's not contributing. Usually those babies have some trouble.
Right.
Not like long term, but like they're not that happy right away. So they usually end up finding someone like me, which is great. But that's
so. At the beginning of the show, you talked about your integrative approach and how, we've talked mostly about the adjustment, but you mentioned things like nutrition or homeopathic, ergonomics, and that sort of thing. Let's talk a little bit about nutrition.
Nutrition, yeah.
So here's a baby who's maybe breastfeeding.
Hopefully breastfeeding.
Yeah, hopefully. Yeah. What can you do about nutrition?
So particularly when they come in through with something like colic or constipation, usually the constipation is a strict structural thing because chiropractors deal with the spine primarily, and the spine houses the nervous system, and the nervous system tells all the organs what to do and when. Usually when you remove the interference in the spinal column, babies are so smart, like I think every day out of the womb we lose a little bit of contact with our natural self. But I think when you get everything out of their way, they know exactly what to do. But one of the times where that doesn't happen so much, a little bit with constipation, but more often with colic and gas, sometimes reflux, all of those get put into the tub that I sort of address as a two-party issue. And it's if they're nursing, then it has a lot to do with what mom is eating, and to help her understand where, depending also on her constitution and what her optimal diet would be. But there's a list of high percentage foods that can really upset baby tummies, and having a colicky baby is great motivation to not eat blank or whatever.
Oh, absolutely.
So just helping them through
So
that.
what are some of the classic foods that you've seen will
fire up a child? Yeah, it does depend somewhat on the constitution of the mom, but it's interesting. Dairy is probably one of the first ones. Kale, interesting. A lot of the breast casing doesn't go well. These are only with kids. I mean, most of the time they're fine, but maybe they're a little bit more sensitive, or maybe mom's more sensitive than she realizes. Yeah. Some of my best friends are super, super healthy eaters and raised by naturopaths, and she couldn't have a leaf of kale the child would let her know that night. It was no way. Sometimes it's dairy. Just understanding what the heaviest hitters are, and then eliminating all of them for like a week or two, and like you notice in 48 hours, and it's fine. But then you introduce one at a time very carefully, and that child will let you know which one they don't appreciate. Well,
and what's obvious to me is that whatever the mom's digestive health is will definitely determine the quality of her breastfeeding and then her baby's digestive experience as well. So if she's having trouble with certain foods, then she might not notice it until it's in the baby.
And whatever inflammatory cytokines are circulating in her physiology, whether or not they're enough to hit threshold, the baby has a higher bar.
So how about the homeopathic aspect?
So I do a fair amount of referring in this department. I have a lot of great books in my office for general baby and child wellness. Homeopathy is a highly underrated discipline, in my opinion, professionally speaking. It is super easily accessible. We have brilliant homeopaths. Again, finally, thank you. And it's cheap. It's really, really cost effective for parents, and it's one of those things that I think isn't utilized enough. And it's totally minus side effects. To have a remedy that you can give your child, and understanding how to do so and when, without worrying about any of those other things, is I think invaluable as a parent. That's incredible. So I do a lot of basic stuff, and then I refer to some of the brilliant people in our area for specific or constitutional or acute cases. With homeopathy. So
are there specific conditions that you see respond really well to homeopathy, or?
It's more that anything that doesn't respond really well, and that's not often, I sort of recommend homeopathy as a basic approach to parenthood, understanding there's a whole book. Who wrote that? Your 7 childhood remedies that cover most stuff that happens in your first 10 years, kind of thing. That sort of stuff works great, but mostly I'm pretty successful in my office with what I do, and working with the pediatrician, who may be an MD or a naturopath, working with them and making sure that we're all on the same page as far as what the parents are going to choose to do. Some parents take homeopathy and run with it. They're just so excited. Some are like, got to read a really big book, or I'd rather just go and see somebody who knows this stuff.
I have one of my favorite health stories I want to share with you and with our viewers as well about homeopathy and how it changed my life. As a kid, I used to have the constantly swollen tonsils. Every cold, my tonsils would get so huge that I couldn't swallow. The pain was excruciating, and so I got scheduled for tonsillectomy. So my mom said to the doctor, you know what, we're going to go talk to my friend, the homeopath. We'll come back. So we went to see the homeopath. I got on a diet and homeopathic remedy treatment that was 2 weeks long. I actually loved the food. I remember loving the food that they put me on. I was probably 8, like 7 or 8. And they put me on this homeopathic treatment. Didn't have the surgery, never had my tonsils removed, and I have never had inflamed tonsils again.
That's great.
Ever, which is
so cool.
incredible.
Yeah, and that remedy cost your mom probably $2.
Right.
Like, it's incredible. It's particularly for kids, even more so. But that's part of, we're very lucky here in Vermont to have practitioners like that around. There's lots of homeopaths that can actually diagnose online because they don't often do much physical. It's a lot of, they're basically walking encyclopedias as far as their knowledge.
But it just sounds wonderful that you're looking at the spinal structure, the nutrition, the homeopathic possibilities. And so what about the ergonomics? How does that
one of the
play a
things that
role?
I think a lot of parents we just don't get oriented that like there are a lot of things that I'd add to the orientation package on your way out of the hospital or out of the home birth or whatnot, things that I think a lot of people don't think about. The way we change diapers, for instance, I think a lot of chiropractors recommend you change them a little bit differently than most people, just because of the spinal strain in there, and depending on what sort of birth the child had. A lot of the way that parents carry children, I find there's an overwhelming trend that most of us carry a child to soothe them and to burp them on their non-dominant side. Every now and then they'll have, like 20% of people carry them on their dominant side all the time, which I find fascinating, but most people want them off their dominant side so they can do stuff and not feel entirely out of commission while the child needs to be held, which I totally understand. But my general argument and presentation to the parent is that unless you're using something very sharp or writing, it's very helpful for their brain to do everything with the other hand. As annoying as it is, it's actually been proven to be one of the tricks that helps stave off things like Alzheimer's and dementia and whatnot, just really cross-exercising your brain. But it's also structurally really important for the baby, let alone the parent. Like I'll often talk about pelvic distortion and lumbar curves and whatnot with the parent who's always got the child on this hip, but that won't spark a change in behavior.
So what you're talking about is balancing, not just switching from the non-dominant hand always to the dominant hand always, but actually
it's
balance.
Having them even, and between caregivers as well. If dad has the child 2 days a week and mom has the child 3 days a work week, like to make sure that somewhere in there you're both within your own schedule. The only time it works for the child is if you're pretty perfectly 50-50 and you insist on this and he insists on this. Then the child will be fine, but you're both, my goals are really to help people figure out the best and easiest balance.
So what you're saying is then that the baby's spine, if you're holding the baby always in your left arm, then the baby's spine is going to be tilted somehow.
It actually gets a little curve. I can always tell which side they're carried on, even newborns, let alone toddlers. If I've never seen them before, I know which side they were carried on as an infant. And a lot of people, that's what freaks them out and gets them into complying with the balance thing.
Wow.
Which makes sense. We always have our kids' needs and priorities higher up than our own. But it's been really interesting to make sure that kids do get tummy time. It's very important.
Right.
Or have their diapers changed easily and gently with a minimum of distraction. But also, I think the car seat stuff is really helpful to understand that kids don't belong in there all the time.
Yeah.
Most parents in Vermont don't.
And
do that
what
so
about
much.
These carriers? The backpack carriers,
12
or
different types of
all
carriers.
Of the wraps and
Mobies and
Do you see any of those being better than others, or are some just horrible?
It really depends what the needs of the parents are. But there are a few. I really like the Ergo Baby. For a newborn,
which one's that?
Ergo Baby. Yep, the Ergo carrier. It's because they have an infant insert, and a lot of the carriers, unless they're slings, unless the child can be sort of supine, even on an angle, trying to get them upright when they're that little just doesn't work. They're just mush, and they're going to kind of crumble in one way or the other, whereas the Ergo Baby actually has an infant insert that you put in the carrier, and then you can
And then
fit
you
the
slide the
infant
baby
in there.
in.
Yeah, they're basically like kind of swaddled in this thing, so they have some support. Otherwise, they just kind of like mush.
Yeah, exactly.
And particularly if you're walking fast and you're a tall person, that's a lot of axial load on that child's spine.
Yeah.
So we like them to either be in slings as newborns or youngins. But once they're quite, they can be in just about any of those
Right.
things. It's more about like, can I put this on myself with the child, or do I need 3 people to help me, or like all of those different things that
And some
factor
babies
into
seem
which.
to love being in those swaddle kind of things.
Yeah, some babies like a lot of compression and security, and some really don't want it. Don't want
like
socks on, don't want pants on, don't, you kind of have to cast the dice with which child you get, but it's neat.
So I want to show our viewers some of the different websites that you want to refer them to, as well as your own website where they can reach you if they have a baby that needs to be seen. So the first one is Dr. Sepic's website, synergichealth.com. You can write that down. And so tell us a little bit about each one of these next ones. Naturalchild.com, what's that one about?
The Natural Child is a wonderful parenting book about all sorts of different learning abilities and ways of relating with your child. The Doctor Within has a lot of guidelines as far as really understanding how to be in tune with your child's needs, often before interesting things happen.
Okay.
Kelly Mom is similar. There's, I believe, a blog on there, a big conversation between moms all over the world. The IHP.org is that's actually an organization that supports parents who have both well children but also injured children. So neurologically injured, if they've got behavioral or neurologic deficit. The IHP is a wonderful access point.
And what does
for them.
IAHP stand
That is
for?
the Integrative Alliance of Health Practitioners, I believe.
Okay.
So yeah, they're all certified and specifically neurologically.
And then naturopathic.org.
That's where you can go to actually locate a naturopathic doctor in your area. Naturopaths are my favorite portal of entry physicians for pediatrics because they often do acupuncture, herbs, homeopathy. They have just a very holistic, non-invasive care model. And there's a lot of home care and a lot of stuff that I think has been put by the wayside in our more traditional ways of being. I'm happy to work with anyone from any angle, but it's I think naturopaths are fantastic for kids.
So from the first moment that they're born to, I guess, through all of childhood and into adulthood, what you're saying is that kids could really benefit from this kind of integrative approach that you have. Is there anything, we have about a minute left, is there anything that you said you might think, oh my God, we haven't mentioned this?
Well, I think probably the biggest, it's interesting because sometimes you need a symptom to take a child somewhere, but in general, even though it's the same thing happens with adults, I came in for this, but I noticed that benefit. Is that weird? And I'm like, nope, a lot of people report that benefit. Probably on the parental side, the things that parents notice significantly, which is why I ended up becoming a chiropractor from my own personal experience, was immune benefit. Their immune systems just seem a lot stronger. And also their behavior seems to just settle.
Excellent.
And they seem to be more in line. So for whatever that's worth.
Well, thank you so much, Erin, for being with us.
Thank you so much for having me.
Thank you for joining us. You can contact Dr. Sepic at synergichealth.com. As you have learned today, everything from ear infections to colic to problems latching and just general whininess and fidgetiness. Everything is, your baby's trying to tell you something, and it sounds like Erin has a wonderful way of helping you with that. So I hope you'll join us next week, and thank you again.
Thank you so much for having me. That was great.
Take care.